You know the old saying that close only counts in horseshoes and hand grenades? Well, the same saying applies to the medical profession, but in a much bigger way. In the days of paper medical records, physicians and RNs dictated or wrote their reports after a procedure was finished. This process took time and was vulnerable to incomplete and inaccurate documentation. Introducing eMerge, a revolutionary new workflow and medical record system that uses voice commands to document medical procedures and complete physician and RN reports in real time. A system that accurately captures, tracks, and monitors patient data from pre-op to procedure to recovery, and that eliminates the unnecessary manual steps, people, and time involved in the more cumbersome and labor-intensive processes being followed today. And perhaps most importantly, eMerge greatly improves the accuracy and quality of information collected, ensuring a perfectly documented procedure every time. Let's see how it works for a colonoscopy. Most pre-op data is entered prior to the patient's arrival through a secure web portal, and all of this information is pulled into the patient's chart after it's validated by the pre-op nurse. When a nurse gives medication commands to eMerge, the system checks for potential drug interactions and allergies, and notifies the nurse of any potential conflicts through the headset. If no concerns are detected, the administered medications are automatically documented in the physician report. The nurse then tells eMerge that the procedure has begun, and it notes the time. The physician will photograph all significant landmarks and findings. Simultaneously, all photographs will be labeled using voice commands given through a wireless microphone. This ensures accuracy and enables auditing to prove a quality exam. In the not-too-distant future, physicians will be paid based on the quality of the procedure. Quality will be qualified by questioning the steps of the procedure. Was the cecum really reached? Was there really a 1.5 centimeter polyp we removed? Were there 12 or 5 polyps removed? What was the polyp morphology? eMerge allows physicians and nurses to simultaneously photographically document and label the findings in an accurate, seamless manner. All reports can be altered to fit circumstances, but the eMerge system documents all changes after the initial report is reviewed and saved. It also integrates the pathology report and recalls into the system. This allows documentation of the appropriateness of the recall interval, allowing the physician to prove that the recall interval fits with current guidelines. And when it comes to a detailed visual record of the procedure, eMerge can import photos and videos right into the report, eliminating the need to print photos and trusting they'll make it through the transcription process and into the completed final report. Just to be sure that everything is correct in the report, eMerge has a playback feature that allows the physician and the nurse to review each entry on the spot. As an added layer of protection, each voice command is also represented visually on the same screen being used to view the procedure. Once the procedure is completed, eMerge's patient dashboard notifies nurses in the recovery room that a new patient is on the way. eMerge's medication tracking feature lets nurses know what medications were administered. Vital signs are automatically monitored and documented directly in the system, and it's all done without ever needing to decipher what's written on a paper chart. Instead of recovery nurses having to track patients at regular intervals, the eMerge recovery dashboard notifies the recovery nurse's station when it's time to monitor a specific patient. It's important to note that eMerge is not a voice recognition program. It does not simply translate spoken words into text on a screen. eMerge has a custom speech processing engine that only responds to specific commands based upon specific procedure scenarios. The commands recognized by eMerge are based on the same keywords and phrases used by doctors and nurses while performing medical procedures, so no need to learn a new set of commands. Since it only recognizes specific commands, ambient noise such as music and conversation will not interfere with the documentation process. Accurate and timely information is the key component in providing quality care. eMerge's HIPAA-compliant system automates the procedure documentation process and eliminates the need for paperwork. Accuracy is paramount, and the process is made more efficient so physicians and nurses can focus on what they do best, caring for patients. Bottom line, eMerge eliminates paperwork and increases your efficiency while lowering your cost and producing an accurate, perfectly documented report every time. Put eMerge to work for you.